Today we're going to talk about Nipah virus, about the virus, how it transmits, the symptoms, and how we can prevent this infection. First, we're going to talk about the virus. Nipah virus infection is a zoonotic disease, meaning that it can spread between animals and humans. It is an RNA virus and it has a lipid bilayer envelope. The reservoir is infected fruit bats. Reservoir is where the virus lives, multiplies, and persists. Next, we're going to talk about the transmission. First, let's see the diagram. Firstly, the fruit bat with the Nipah virus infection feeds on the date palm sap. Other fruit bat picks up this infection from the date palm sap. In the second point, we can see that the date palm sap to human transmission is occurring when the human intakes contaminated date palm sap. Thirdly, the fruit bat with the Nipah virus infection feeds on fruits, and this infected fruit can lead to human transmission with human intake these fruits. In the fourth point, we can see that the pig feeds on these infected fruit contaminated with Nipah virus infection, which leads to the transmission to this pig and which ultimately leads to human transmission via the animal handlers and those who intake these pork meat. Lastly, we will see the man-to-man transmission via close contact and respiratory droplets. To sum it up, the transmission occurs via four means: the date palm sap contaminated to human transmission, contaminated fruit to human transmission, animal to man transmission, the animal handlers and intake of pork meat, and man to man transmission via the close contact, respiratory droplets, and other secretions. Next, we're going to talk about the symptoms. Patient can present with fever, headache, vomiting, muscle pain, cough, sore throat, and respiratory problems. If we talk about treatment, there is no vaccine or specific cure to Nipah virus infection. The care focuses on mainly the intensive supportive treatment. Next, we are going to talk about how to prevent this infection. So firstly, when we are collecting the palm juice, so we can boil it freshly before consumption. Secondly, thoroughly wash and peel any fruit before consuming it. Wear gloves and other protective clothing while handling sick animals. Avoid contact with infected pigs and protect pig feed and pig shits against bats. To prevent the human-to-human transmission, avoid unprotected physical contact with people suspected of carrying the infection. Wash your hands regularly after caring for people who are sick or suspected of having the infection. And ensure proper waste disposal and wear masks, gloves, and gowns in the healthcare settings.